Hello everyone, myself Dr. Prateek Garg. So today we will discuss about anatomy of middle ear. So nothing great. We all know middle ear is the middlemost part of the ear, so which helps in conduction of sound, mainly responsible for conductive hearing, that is by means of air conduction. We all know the sound coming from the surrounding will hit the tympanic membrane while passing through external auditory canal, and then these vibrations from tympanic membrane will travel through the middle ear by means of middle ear ossicles and then enters into inner ear. So how does it help? These ossicles, they generally augment or amplify the sound, and this sound energy will be converted into the mechanical energy, and this mechanical energy will get transmitted into the inner ear, where it again get converted into the electrical impulses or signals. Now this is a basic diagram showing the ear, where we can see this is my external auditory canal, then comes my tympanic membrane, and through this tympanic membrane the three ossicles of the middle ear are attached. The first one is malleus, next comes the incus, and third one is stapes bone. This stapes bone is further embedded, or we can say attached to the oval window, and the vibrations from the stapes bone will directly transmitted into the oval window and then into the cochlea, or we can say the perilimb. So this mechanical energy will produce a movement in the perilimb, further leading to the conduction of the sound, and thus we hear the sound. So this is the basic middle ear anatomy. What are the parts of the middle ear? It is divided into four parts. So first one is epitympanum, that is above this level. Okay, above the level of scutum, or we can say above the level of tympanic membrane, we can see that. So it is the attic area. Then comes the mesotympanum. That is the part of the middle ear opposite to the eardrum or the tympanic membrane. Then comes the hypotympanum. That is the part below this area, below the mesotympanum. And one more part is a protympanum. Protympanum is the part of the middle ear which is against or opposite or at the eustachian tube side. So these are the four parts. Epitympanum, we know, that lies at the level of pars flaccida, or we can say above the scutum. Mesotympanum just opposite or the facing part of the middle ear at tympanic membrane. Okay, or we can simplify words, we can say pars tensa, more correct words. Okay, now what is middle ear cleft? Again asking the exam. Middle ear cleft, it consists of middle ear, eustachian tube, adductus, antrum, and mastoid ear cell. So it has been asked in the exam. They have given 4 to 5 options, and we have to exclude the wrong options. So cleft is made up of middle ear, eustachian tube anteriorly, posteriorly it is attic, antrum, and the mastoid ear cells. Again, this is a diagram just to give a better idea how this middle ear look. So this is my tympanic membrane, you know, and this is my umbo, or we can say manubrium of the malleus bone, and this malleus bone is then connected with this incus bone. They are making a joint. It is a ball and socket joint, and then this incus is further related to the stapes bone, and then these vibration or sound energy can be transmitted towards the inner ear, like the shown in the diagram. So we can see this is the inner ear, where we can appreciate the semicircular canals, the cochlea, and midway we can appreciate the oval window, round window, and medially if we see there is utricle and saccule. So understood? This is the eustachian tube into the middle ear. It is a part of the middle ear cleft, and this eustachian tube opens up into the nasopharynx, just behind the posterior end of inferior turbinate. Now, suppose this middle ear, if we look out at the 3D, so we have to assume this middle ear, it is like a cube. So if I look at the front, suppose this is my front, I'm looking like this. So the posterior wall, this wall is the medial wall of the middle ear. Okay. and anteriorly, suppose we are looking from this side. Okay, this was diagram looking from this side. So the wall which is coming first in the context is the lateral wall, and the wall which is facing towards the inner ear is the medial wall. This is my anterior wall. Anteriorly, we all know the eustachian tube comes. So this is my anterior wall, and this is my posterior wall. So above is the roof, and below is my floor. So I hope you just can imagine how this is shown in this diagram. This is a 3D picture of the middle ear shown from the lateral side. So literally, what is in the middle ear? If I look from lateral side, we can see the tympanic membrane. So literally, tympanic membrane is present. Now look at the floor. In the floor, there is a thin plate of bone which will separate the jugular bulb from the middle ear. So floor, it consists of a thin plate of the bone separating the jugular bulb from the middle ear. Sometime in some rare cases, this bone is either decent or absent or very thin. So whenever we try to do the mastoidectomy or we just drill out this area, jugular bulb may get perforated and sudden gush of the bleeding comes in the surgery. So we have to be cautious. If this bone is decent, as jugular bulb, if suppose is popping up in the middle ear, so it will give a bluish appearance. Okay, so this is floor. Look at the roof. What is the roof? Roof is separating from the dura mater of the middle cranial fossa. So this is my roof of middle ear. Now comes the anterior wall. Look at the anterior wall. Above one, there is a canal for the tensor tympani muscle. This tensor tympani muscle, we are talking about the anterior wall. So we will start from the top, then goes to down. So superiorly, it is the canal for tensor tympani muscle, and this tensor tympani muscle is attached to malleus bone. Malleus bone at the level of the neck of the malleus bone, under surface of the malleus bone, this tensor tympani is attached. So above is the canal for tensor tympani, then comes the pharyngotympanic tube, or we can say eustachian tube. This eustachian tube will open up into the nasopharynx. What is the function of this eustachian tube? Eustachian tube generally balances the air pressure into the nasopharynx and the middle ear. So it is a communicating tube, and these middle ear mucosal secretions will also drain into the nasopharynx. So we all know whenever there is a dysfunction of the eustachian tube or any pathology of eustachian tube, that will lead to collection of serous fluid into the middle ear, because the secretions can't be drained out, so there will be collection of the serous fluid that will further lead to serous otitis media, and sometimes it get infected, leading to acute otitis media. And what comes next in the anterior wall is the thin bone which is separating the carotid canal. You can see this is my carotid canal, and the branches from this internal carotid plexus. So you imagine this middle ear, how complicated or how difficult it is. Interiorly, we can see the internal carotid arteries just running in close proximity. Floor, we can see the jugular bulb is there, or internal jugular vein is there. Okay. Okay. And we can also see the chorda tympani nerve is also coming from the anterior wall. It is deep down, lowermost. Okay, then comes the posterior wall of the middle ear. Look at the posterior wall. Firstly, we can see adytus. What do we mean by adytus? Adytus is an passage. It is in passage to something. So adytus to mastoid antrum. The examiner has written adytus to mastoid antrum. That means a passage to the mastoid antrum. So posteriorly in the appendicular, there is an adytus which is a passage to the antrum. What is mastoid antrum? It is the largest air cell of the mastoid cavity. And what the next come in the posterior wall is the pyramid. We can see this is my pyramidal eminence. Okay, so this is my pyramidal eminence, and what next come is the chorda tympani nerve, which is a branch of facial nerve. Okay, so three structures coming into the posterior wall. First one is the adytus to mastoid antrum, then comes the pyramidal eminence and the chorda tympani nerve. Now we talk about the medial wall, which is the most complex wall of the middle ear. So what is the medial wall? The wall of the middle ear facing towards inner ear. So in the center we can see the, what is this? Promontory. In the center there is promontory. Over this promontory, what is this? This is in branches from internal carotid plexus, that is a venous network is there. So this is promontory. And see, look at the top. So starting from the top, firstly there comes a prominence of lateral semicircular canal, LSC dome. So lateral semicircular canal dome is at the medial wall, it is at the posterior superior region. Then below than that comes the facial nerve. This is my facial nerve, horizontal part, which is running over the medial wall. So this is my facial nerve, horizontal segment of the facial nerve. And then comes the oval window. You can see the oval window, you can appreciate the oval window. Then comes a promontory, and then below the oval window comes a round window. I marked it in the blue. This is my round window. And anteriorly there is tensor tympani muscles and processus cochleariformis. So this is a table what we have discussed. In the floor there is a bone separating jugular bulb. Anteriorly superiormost is the canal for tensor tympani, then comes the eustachian tube, and lower down it comes the bone separating the carotid artery. The posterior wall we have discussed above is the editors, then comes the pyramid, and then comes the chordae tympani also. Lateral wall we know the tympanic membrane is there, and medial wall again very important, asked multiple times in the exam. Firstly, posterior superior region we have discussed the impression of the lateral semicircular canal, and between the lateral semicircular canal and oval window the facial nerve runs. And which part of the facial nerve? Horizontal segment of the facial nerve. And then in the midway it comes a promontory, that is an impression of basal coil of the cochlea. So the basal coil of the cochlea gives an impression in the middle ear, which is known as promontory. And then comes the oval window, and then comes facial canal and the round window. This round window is also known as secondary tympanic membrane. Secondary tympanic membrane, because it is a membranous structure. The primary tympanic membrane is a tympanic membrane, as secondary tympanic membrane is my round window. It has been asked once in the exam. And then comes a processus cochleariformis. This is again a surgical landmark for the facial anatomy. Now what is facial recess? Facial recess is an area between the chordae tympani, between the seventh cranial nerve, that is a facial nerve, and the fossa incudis. How come the facial recess appear? Suppose this is my facial nerve. Okay, horizontal part, and then comes the vertical part. And this vertical part, from here this chordae tympani now joins. This is my chordae tympani now. I'll mark it in the red. This is my chordae tympani now. This is my facial nerve, and there is a fossa incudis where the short process of incus makes a fossa. It dips down into a fossa. So this area is known as a facial recess, which is bounded medially by the facial nerve, laterally by the chordae tympani nerve, and above is the fossa incudis. I hope you got it. And then comes a round window, which is also known as secondary tympanic membrane. When we talk about the ear ossicles, the first bone is the malleus. We all know this is my umbo of the malleus. The long process looking like structure is the manubrium. This is the manubrium of the malleus. And then comes the anterior process. Pars tensa is at this level. Till this level, I mean, above it starts the pars flaccida. And you know what is this space? Suppose this is the tympanic membrane attached to the malleus. So above the anterior process, so tympanic membrane is firmly adherent with this, and there is this fossa-like structure at the level of the neck of the malleus. This is known as Prusac space. Prusac space. P-R-S-S-A-C-S, We all know Prussic space. What is the importance of Prussic space? This Prussic space is actually the first site of cholesteatoma, because the cholesteatoma will get accumulated here. So this is Prussic space. So this is my malleus, which is consist of a head, neck, manubrium and umbo. Then comes my incus bone. These both bones are making the synovial joint, that is a ball and socket type of joint. Then comes the incus bone. In incus bone there is a long process. This is my short process, which is going into the fossa introduce. Then comes the long process. Okay, and then further articulate with the stapes bone, which consists of anterior crura, and then comes the posterior crura and the foot plate is there. I hope you understand. So there are two muscles in the middle ear. One is the tensor tympani muscle. This muscle is attached at the level of the neck or the under surface of the malleus. This is here the tensor tympani muscle. It is coming from the anterior wall and getting attached to the malleus neck, or we can say under surface. It is supplied by the mandibular nerve. And the another muscle is the stapedius muscle. This stapedius muscle, it is attached to the stapes head or the neck. So it is supplied, stapedius muscle is supplied by the facial nerve. And what is the importance of this? It does dampens the loud sound. Whenever the louder sound hits to the middle ear, so the stapes vibration will be very much. So what happens in that case? The stapedius muscle, when it comes into action, it will just tighten up the stapes muscle and thus dampening or the lowering down the extreme vibration of the stapes bone, and thus leading the decreased conduction of the loud sound into the inner ear. Thus that's why protecting the inner ear also. So stapedius muscle got a protective role, and it is also play a role in the tympanometry. And in facial paralysis patient, this role is lost. That's why there is a phenomenon where the louder sound may sometimes be unbearable to the patient. So now there is another triangle which is known as McEwan's triangle. What is this McEwan triangle? Suppose this is my external auditory canal. So what is the McEwan triangle? It is a triangle which is bounded superiorly by the suprameatal crust, or we can say inferior temporal line. This is a thick temporal crease-like structure above the external auditory canal. So this is my suprameatal line. Then comes external auditory canal. If we look at the external auditory canal, there will be spine of Henle. So line drawn from spine of Henle, suprameatal crust, and a tangential line joining the both. So this is the area. I'll mark it in the yellow. So this is the area which is my McEwan's triangle. How this triangle is important? This triangle is important to locate the mastoid antrum. So what we'll do whenever we have to do the mastoidectomy, we will drill out in this McEwan's triangle to reach out in the mastoid antrum, which is the largest cell of the mastoid ear cavity or mastoid cavity. I hope you got it, what is McEwan triangle and its importance. Now, sometime while doing the mastoidectomy, there comes the corner septum. See, mastoid antrum, roughly it is around 1.5 centimeter deep as compared to the mastoid bone lateral surface. So laterally, if we go from the mastoid lateral surface, if we go medially, it is roughly around 1.5 centimeter deep down. Sometime whenever there is an, we all know this is my squamous part of the temporal bone, and deep down there is petrous part of the temporal bone. So sometimes this squamous and petrous part bone, they meet at one point. So there will be one septum will remain there. It will not get absorbed. So this septum is known as corner septum. So this thin, it will have thin bony plate. So how it is important? Whenever you are drilling this, so this junction of petrous and squamous part where there is a thin bony septum is present, so it will misguide us about the mastoid antrum, because if this septum is calm, we will think that we have reached out to the antrum. So it is not like that. We have to drill through the corner septum if it is present to reach at the mastoid antrum. So corner septum, this is surgically important. This is corner septum. It is surgically important. Why it important? Because it may cause difficulty in locating the antrum and the deeper cell, and thus lead to incomplete removal of the disease while doing the mastoidectomy.